Welcome everyone to the second annual People of Color Living with Diabetes Virtual Summit, where the theme is Voices of the People. And I'm so excited for this session. This is our community group panel called Diabetes Access Around the World. I have a couple of amazing people with me here today to talk about just the access that is available for people living with diabetes all throughout the world. So my name is Kacey Creel, and I am the co-host for this year's summit. And I'm going to pass it off to Sarah, and she's going to go ahead and introduce herself.
Hello, and thank you so much for having me. Again, my name is Sarah Grant. I am the Chronic Disease Management, Education and Resource Development Officer for Black Beetle Health. It's a charity located or based in the UK that focuses specifically on Black and minority ethnic as well as LGBT communities on a host of different issues. But of course, particularly my area has to do with education, awareness, and signposting for individuals with chronic conditions. So I'm glad to be a part. I have been, I'm a public health practitioner as well, and have worked in health education for several years now, and particularly diabetes education. So I'm glad to contribute to this conversation today.
Awesome, thanks so much for being here. Mariana, do you want to go ahead and introduce yourself?
Yes, thank you, Kacey. First of all, thank you for having me here again. It is a pleasure to be again in this summit, and thank you for the invite. My name is Mariana, and I am currently Director of Emerging Markets at Beyond Type 1. I was diagnosed with type 1 diabetes in 1984, and I believe that I can honestly say that I've been advocating for diabetes in my country since then. My parents were the first diabetes educators that I knew, and they were slowly teaching me how to advocate for myself and my rights. And I have to be always recognizing that I've had the privilege of being able to have my treatments on time and in a correct and adequate way. And that makes me have this moral obligation to provide support to people who are less fortunate than what I've been. So it is my duty to provide diabetes education. I am now a diabetes educator and a psychologist. So it is my moral duty to provide people back some of the things that I've received from the community. I feel the need to give back. So I currently work, as I have always worked, in providing information, diabetes education, and of course, tools for people to become their own advocates. I hope that in this session, we can learn more about how diabetes is lived in other countries, because that also will help us have a different perspective of how we can also work together as a community.
This is very true. Thank you so much.
Okay, thank you for having me. My name is Ogundele Olayemi. I'm from Nigeria, Western Africa. I'm a chef, and I've been a type 1 diabetic for 6 years now. Okay, I'm just here to talk about how we can improve lives of diabetics. Okay, now there are shows that you can eat some foods. I'm a chef. Okay, I'm talking about food here. There's some foods that you're gonna eat. You can eat all type of food. Okay, but you just have to have them in the right proportion, the right quantity. Okay, and determine your insulin, because when you take your insulin, you have to determine your insulin type of food you're gonna eat. So basically, I'm just gonna talk about what you're gonna eat and how you can live a healthy lifestyle with your diabetes. Thank you.
Awesome, thank you so much. Thank you all so much again for being here. So we've talked about that there is barriers to people receiving diabetes access around the world. And I just want to kind of jump right into it and hear the experiences that you guys have seen for the diabetes community where you live, and kind of the barriers that you've noticed for people to receive diabetes education and supplies. Mariana, do you want to kind of explain that a little bit more?
Yes, of course. I see that the first barrier that we face, at least from my country, is not only the lack of access to the tools that we need, basic treatments like insulin, glucose meters, glucose test strips, but also diabetes education. Because sometimes we do have access to the very basic tools like insulin, but without diabetes education, there's nothing that we can actually do and put in place to take the best decisions and then to live a healthier life. So I would say that is the first barrier of all. And then, of course, there's the economical issue. In Mexico, I've seen some data, and perhaps only 3 out of 10 people will be able to pay for their supplies in a monthly basis. And from other countries, we often believe that insulin is cheaper in Mexico. Well, yes, that is true if your currency is US dollars, but it is not if you live in Mexico, which means that we have to become better and bigger advocates for our own people to help them take the best decisions with the tools that they have. So that is perhaps the biggest access barriers that we have, the lack of information and diabetes education, and the lack of these very basic supplies that we need in order to stay alive. And also these lack of teamwork, I would say. We are lots of people living with type 1 diabetes all around the world. And if we work together, we will reach our goals faster. So this means that we need to advocate not only for ourselves, but also for people who live in different areas and other countries that have different needs. We have to be very mindful that diabetes is lived different in each and every corner of the world. And also in different cultures and in different languages. So providing access and tools for everyone is not always possible if we don't work as a team. So I would say that perhaps for me, those are the biggest barriers, the lack of information, the economical barrier, of course, and the lack of teamwork, that we are still going to be able to work if we gather.
Yeah, that's so true. Collaboration is a big thing amongst our community. You know, we call ourselves our, diabetes community, and that really, the underlying thing for that is to have teamwork and collaboration and just have empathy and understanding for other people who are across the world and living differently, and kind of understanding that as well. Sarah, I kind of want to address that question to you as well. What have you kind of noticed with barriers?
Yes, it's so interesting to have this panel of individuals representing different parts of the world, because I think we have an assumption that because information is out there, that everyone has it, or that technology is out there so that everyone has it or has access to it. And even in the UK, where yes, it's a quote unquote Western country, very diverse access and well-established access to healthcare. They have universal health insurance. They have things like that, where individuals don't have to necessarily pocket for basic services. But on another hand, there are some disparities there, because for those who may be non-citizens, who may be new to the country, are still establishing, they may not know about the services that are available to them. And there might also be language barriers. You know, the UK has immigrant populations, just like many other countries do, immigrant populations that may not be aware, may not feel comfortable approaching certain things with their provider. And so these can be barriers to healthcare access. Yes, the healthcare is available, but if the individuals do not feel comfortable or are not aware that they're available, then they're still going to be at a disadvantage as far as getting the care that they need.
All right, Sarah, so I kind of wanted to propose that question to you about different barriers that you've seen where you live.
So of course, Black Beetle Health is located or based out of the UK. So in the UK, of course, they have universal health insurance. They have the NHS. So you would think that that access to healthcare as well as education is freely available to everyone. But that's not always the case. Yes, it is basic healthcare is free to everyone, but of course it also requires individuals to know that it's there and available. It could be immigrant populations, it could be individuals for whom English is a second language and it presents a barrier for them seeking care. Some individuals may not feel comfortable, whether they may be representing a member of the LGBT community or other populations where they may not feel comfortable seeking care for their other conditions, such as diabetes, or even to get screened. Something that also occurs to me is that in the UK, it's a little bit different than other countries such as the US, where the push for screening for prediabetes is very prevalent, but in the UK and some other countries, they have a little bit different ideas and guidelines about that. So that early detection is a little bit different in the UK. So if people don't ask for it, the providers may not, if they're not eligible under the typical guidelines, the provider may not offer it. So sometimes there's a barrier there.
Wow, that's so interesting. I like, you hear different parts of the world have universal healthcare and you're like, wow, that would be so amazing. But it is too good to be true because prevention is such a huge thing. And yeah, I really do see that here. That is being pushed more heavily in the last couple years, but that's very interesting. So Ugandale, is there anything in Nigeria, like the different barriers that you've kind of noticed about people receiving diabetes education?
Yeah, like there are many barriers actually, because I've never seen the government providing any free healthcare for diabetics. No, I've never seen that. I've seen non-governmental organizations doing that on their own. And the second thing is that the drug is scarce, the insulin is scarce to get. Like I think some days back, I wanted to get insulin and I was told to switch from Mixtard to Lantus and Atrapid. And I went to the store to get it and they didn't have. I had to check like four other stores, before I could get insulin. So it's very scarce around. I don't know why it is that way. And I think the government should really, do something about it, because its price is not really affordable for everybody out there. Like I said earlier, I belong to a WhatsApp diabetic group. It's called African Alliance Group. Sometimes I seek up from them when things are not going well and they really provide. So if the government was doing something for we diabetics, I think it would improve lives. It's one of the major barriers. The government is not helping at all. And drug is even scarce. It's scarce and it's expensive. It's very expensive. So I think the cost should be addressed, and more availability of the drugs, and easy access to it should be provided too, because it's a killing machine. It kills if it's not being taken care of. It kills gradually, and its symptoms are very confusing. You wouldn't know what is really going on if you're not educated enough. So I think if the drugs are provided and more availability and more accessible, and if the government should really work into this, I think this will solve the barrier. This will solve the
Definitely. You mentioned that there's a WhatsApp group that you're a part of. How's the diabetes community in Nigeria?
No, it's not in Nigeria. It was created by some people all around the world. Okay, Ugandans, Americans, and a nurse a midwife from the group actually invited me here. Understand? So yeah, and they've been trying to improve lives of people out there that can't afford drugs. They share topics on how to improve your life, on what to eat, how to exercise, drugs, and it's been really doing well for us.
That's awesome. Mariana, I kind of wanted to pass off to you as we're talking about like the diabetes community. What would you say that the community really has a role to play in advocacy for everyone?
Yes, I think that something similar. Of course, it would be dumb for me to compare because these are totally different countries with different needs and with different people. Each diabetes is its own, and also is every person and every country, of course. But what I can see is that the diabetes community sometimes is doing the work that we would require our governments to do. And that means providing access to these very basic tools, these very basic treatments, not only insulin, but also test strips and glucose meters. But the most important thing is providing access to diabetes education. As Sarah mentioned before, information does not mean that it is available for everyone, and information does not replace by any means that formal diabetes education. And that is something that we strongly need the community to provide. So sometimes in my country, what we see is that nonprofit organizations in Mexico, for example, Mexican Diabetes Federation is doing an amazing job, but of course, it's just one small organization in a country where there are more than 14 million people living with diabetes. So this requires teamwork again. And I might sound like a broken record, but here goes teamwork again. And organizations, and especially diabetes advocates and diabetes groups and diabetes influencers as well, we all work together, and we are trying to provide the support for everyone, and not only for people who can actually pay for these diabetes devices and meds, but pretty much for everyone. This of course includes working as a team also with schools, also with pharma, also with government, also with other agencies, also with pretty much other nonprofits that are not directly involved with diabetes, but other health instances. So this requires that all of us take a stand and work together as a team. And that is what I think the power of the community is. Sometimes people do not realize that we are following from other countries. So for example, in my case, I was an active member of Twitter, and I used to read what was happening in terms of advocacy in other countries and languages. The United Kingdom, for example, Africa, for example, and the United States, of course, because it was my north neighbor. So I did learn to advocate for myself by just looking at what the community was doing. And perhaps if we learn how to share this information and localize this information, we will get better and faster results.
Yeah, definitely. You know, you really mentioned teamwork again, and I love that. And within that team is diabetes educators, and you know how you said that there is a need for more resources, but that's not taking place of actual diabetes education. And so kind of want to talk about that now, and the access to diabetes education that is available, where it's proper education with, you know, diabetes educators giving this to people who need it. Where has that kind of been in your country?
In my country, I would say that there's a very small number of diabetes educators, sadly, but we are training constantly our own community. So it is much diabetes education provided by peers, what we would name or call diabetes peer support, peer education. And these groups are mostly supervised by big nonprofits, including Mexican Diabetes Federation and Mexican Diabetes Association. And they are the ones training other people that would work as part of the community and will share their experience and expertise with other members of the community. Perhaps the biggest barrier, once again, for diabetes education is cost, because diabetes educators are not included in our very basic health system. And this is mostly only found in private practice, which is costly. So we need to work better. And we need to make this diabetes education accessible for everyone, which means, again, working with the government, because we need them to realize that if we provide diabetes education, we will make things better for everyone, including them, because this will represent lower costs in diabetes attention, less complications, which will mean, again, lower costs for them as a government. So we need to see them understand the benefits of helping us, the diabetes community, providing diabetes support to our peers.
Yeah, definitely. Going back to that prevention and that playing such a huge role. Sarah, what do you think?
Mariana just made so many good points. Earlier, Mariana also mentioned access to devices, monitoring devices. And as someone who, both Ogundele and Mariana, who live with type 1 diabetes, you can definitely speak to this, but with the advance of the continuous glucose monitoring devices, it's been so revolutionary, particularly for people who live with type 1 diabetes, to have access to this, to be able to manage their blood glucose, anticipate crises or prevent crises from happening and things like that. But interestingly, in some more primary care settings, it's offered or even made available for individuals with type 2 diabetes. So that is something that I hope to see more and speak about more as we go along in the future, that yes, we can see the clear reasoning why it is very helpful for people with type 1, but it's also beneficial for people with type 2 as part of the education process, just to let them know, you know, how to track what things affect their glucose, et cetera. So that's a part of advocacy. The aspect of teamwork is so important. Oftentimes, healthcare professionals may treat people by condition. So this person's coming for diabetes, this person's coming for hypertension, but really we have to look at things across the board. We have to look at addressing various social factors that affect a person's ability to live well or manage their conditions well. So we have to be able to collaborate. We have to realize that, yes, there's a role for diabetes educators who have been trained, gone to school, certified, and things like that, but not discounting the value of the peer support as well. It all plays a part. And I think that you know, there's a lot of progress that has been made, but still definitely more work to do on this front, so that these things are available, so that they're offered to people up front without people having to say, oh, I found this thing online, am I eligible for the, you know, it shouldn't have to be up to the patients to suggest these things. And definitely one last thing that I'll mention is, as I heard Ogundele mention, that, you know, yes, there are things like formularies, there are certain preferred drugs and things in different countries as well, based on what's available. But really, we have to do better about making medications available that are best for the patient, not just because it's on a particular formulary.
Yeah, for sure. At some point, it's, you know, the person living with diabetes, they're the expert of their own body and what they really need. And we definitely need to increase the just work that we are doing to make sure that everyone has that option to use that specific tool, whatever it may be, that is going to help them thrive with diabetes. You know, we can give everyone all of the knowledge that they may need, but at the end of the day, there are some technology that is just so much better to use. So that is definitely some work that needs to be done. But kind of want to shift that a little bit. And, you know, we've talked about advocacy, you know, from the community, but then we kind of mentioned a little bit on the personal standpoint and what that kind of looks like on how to really self-advocate for yourself when you're living with diabetes. You know, like I just said, everyone's the expert of their own diabetes, and we all really need to kind of learn those types of skills. You know, what kind of resources have you seen in your country that helps people living with diabetes learn how to advocate for themselves?
Okay. Resources that I've seen, just think that I haven't really seen any resource, you know, that is pushing for this advocacy. Seriously, the only thing I see is online. Actually, when you go online, when you search for people, but in my country, I haven't really seen. I've searched online, I haven't really seen anything. You know, the only people I've really seen are people that are philanthropists, you know, that are trying to, you know, help out, to reach out to diabetics, you know, try to help out. And they're mostly by philanthropists and individuals and people that have, you know, have this history of diabetes in their family. You know, most of them are not even diabetics, you know, but they have diabetics working with them. And I think it has made them to understand the need to make this an alarming topic, you know, to make I think that's why they are doing it actually. But from the government, I haven't seen anything. Okay, I've had this diabetic for 6 years now, and I've not received any help from the government at all. You know, if there was a center that I've seen and maybe it's closed down, I would have made inquiries about it, but I've not seen any. Even when I go for medical checkups, I still pay in the general hospital that is made for free. That is, the government created that, the government built that hospital for the poor, Like if you don't have money, you should go there, you get yourself treated. We still pay. I still pay there. So I haven't really seen, and all the help that I've gotten from to manage my diabetes has not been from the government. It has been from friends, family, and philanthropists. So there's nothing really I've not really seen anything in my country that is promoting this advocacy stuff. I haven't really. Okay, I'm trying to like make a difference. Okay, that's and I hope so. I hope and pray so.
Yes.
Yeah, I would say in the UK, Obendela just mentioned online support. That has been very helpful, especially in the UK, as far as getting that information out. Again, we have to realize that everyone may not have internet access. So that's another potential barrier. But for those who do have internet access, there's organizations like Diabetes UK, which is one of the biggest, that's actually, a government agency that provides a lot of information and links people to resources as far as diabetes prevention program that's available, as well as diabetes management programs. So there's a lot of information there, but as far as like community support, there are other groups as well that right now still in the virtual space, but like Type Together or diabetes.co.uk is another great resource that individuals can use who are based in the UK, but anywhere really, but definitely focused on based on the guidelines.
Okay, yes, sure. In my country, we see a mix of pretty much everything. Nowadays, and one of the benefits perhaps, and I feel bad for saying benefits of the pandemic, was actually the virtuality of everything. So now we get to see some of our most close friends and diabetes advocates as well via Zoom, which wasn't a thing back before the pandemic. And now we have resources to many digital forms and information and resources and others. But still, as Sarah mentioned, in my country, not everyone has access to internet. So this means that we need to work not only on digital resources, but we need also to train our own community to help them reach these resources in a physical way. There are big organizations and big groups of people working in providing this information, which is good. But nowadays, it is easier for us to find information online, as Ogundele just mentioned. It is easier for us to go and search online for certain topics and certain information, and then just try to localize that information into our own language and also into our own culture, because most information is in other languages, which means that you cannot just hit translate. We need to tropicalize all this information to make it feel like it is part of our community. So this is a very tiring job, because we need to find the information, find reliable resources, translate the information, and then turn this information into something that us Mexicans or us people from Ecuador or us people from Nigeria would easily read and apply into their daily lives, which is a big work. So I would say that nowadays, being able to find these resources online is perhaps one of the most important things that has happened, but still there is a lot of work that we need to do.
Sarah, were you agreeing?
Yes, I just wanted to add one more thing, that, changes happen that we may not always associate with advocacy. But for example, the CDC sponsored diabetes prevention program, similar to the one in the UK, but it's the US version, has recently in the past year or so been revamping the materials that they present for the year-long diabetes prevention program in order to make it more culturally relevant. The meals, the food groups that are listed, not the food groups, but the types of foods in the different food groups we were able to have the freedom to adapt them and make them more relevant based on the community that we're serving. So, when you think about it, some diabetes educator or entity or advocate had to push for that to happen so that it wouldn't just be the mainstream message that may not relate to everyone.
Yeah, that's so true. In the time that you're doing the advocacy work, you feel like, this is getting so tiring and we're not seeing progress, but, later down the road, we are going to see the works from people who have been working so endlessly for our community. And I really am glad that you pointed that out, that, you know, at the end of it, the work that we really do put towards making the world a better place for people with diabetes, it really does matter. So I kind of want to wrap it up here and just kind of ask y'all, like, in the future, like, what would you love to see, you know, for people living with diabetes? I personally am just going to say, for me, I really resonate with Mariana talking about teamwork and collaboration. And so that's what I hope to keep moving forward for our community, is to really have collaboration amongst everyone living with diabetes, no matter, you know, your background or where you live or your just, you know, ethnicity. So Sarah, if you kind of want to take it off, what do you think?
I'm looking forward to the trend of diabetes increasing, going the opposite direction. I'm looking forward to the time when individuals who may have been told, okay, you're in this ethnic group, you're in this nationality, that you're at greater risk. I'm looking forward to the time when people don't accept that as their inevitability, that, oh, because you are from a minority group, quote unquote minority group, that you're at greater risk, et cetera. So I'm looking forward to that message getting out, that there are things that we can do so that people feel empowered to make those changes and seek the interventions early.
Yeah, actually, actually I agree with Sarah over there. You know, in the nearest future, I want to see people coming out, you know, telling the world who they are, what you are, that this, I can have this and I can, you know, be strong. You know, the fear of discrimination and stigmatization is huge in Nigeria. I have two friends that they can't tell people that they are diabetic, you know, because of the way they will look at them in the society, you know. I've even applied for a job in a place, you know. I didn't want to tell them that I'm diabetic because I know they would want to look at me like I can't do this, I can't do that, you know, and they won't want to give me the job. So I had to like tell them I'm okay, I'm fine. So I think in the next future, I want to see, you know, the talk about collaboration, teamwork. I would like to see it happen. I would like to see more people out there coming out and telling the world, okay, yeah, I'm diabetic, okay, but I'm still looking okay. I'm still looking fine. I can still do that. I can do that. I can manage it. It's not a death sentence, okay? I can still do this, even with being a diabetic. Doesn't stop me from doing this and that. Okay, so that's what I pray to see, and I hope to see in the future.
I love that for sure. Like, you know, I love just saying, like, I'm a person with diabetes, because diabetes just doesn't define who I am. I can do so much more. So Mariana, yeah, for sure. Mariana, what do you hope to see for the future of our community?
Well, if you had asked the same thing perhaps 20 years ago, I would have said that I would have liked to see diabetes just disappearing, type 1 diabetes, because I was told that I would only have to wait 5 years till there was a cure, and that hasn't happened yet. So I really resonate with you both, with Sarah and Ogundele, that I really think that we have to change the narrative of diabetes overall. We need to stop seeing diabetes as a death threat. And that means that we have to work better and bigger in terms of advocacy, and not only advocacy for us, and not only advocacy for us, but for everyone, because these tools, of course, are not available for everyone. And we need this to become a reality, just not only for certain groups or certain ethnicities, but pretty much for everyone in the world. So we need to change the narrative, and we need to still work as a team, because we need to let people know what is happening and how it is to live with diabetes in Africa, how it is to live with diabetes in Mexico, how it is to live with diabetes in the United Kingdom. And so that way that we can change our perspective, and we can learn ways and discover ways to work as a team to help just everyone, including health professionals, of course, because I'm sure that there's caregivers among that team as well. So this is the time where we have to work together to change this narrative, to eliminate stigma and others. So this is perhaps one of the few instances where we get together, and I hope that this is our first step to work as a team and to change this narrative overall.
I agree so much. And I think that just as we have more conversations, I think just having a conversation is so powerful, because I know from this conversation we've had today, my eyes have been open to a lot of things that I just didn't really know beforehand. And so I just am excited for that teamwork and collaboration, and hopefully just being more inclusive for our diabetes community to make sure everyone has what they need to thrive with this disease, and know that, like you said, it's not a death sentence. Well, thank you all so much for being here. I have really enjoyed this conversation, and you know, I got so much out of it. So thank you all so much for being with us today.
Thank you so much.
Thank you very much.
Thank you,
Thank you
Kacey.
very much for having me here.